Good afternoon, everyone. My name is Jerome Bailey, and I'm with the ESRD National Coordinating Center. Thank you for joining us for the ESRD Patient Education Webinar event. The ESRD NCC webinar events are held in partnership with the Centers for Medicare and Medicaid Services. We are hosting these 30-minute events weekly. They feature patient and professional subject matter experts from around the country sharing how they or their organization are coping with situations related to COVID-19. Before we get started, I wanted to let you know this call is being recorded and will be posted to the NCC COVID webinar webpage, usually within 48 hours. Let's take a look at today's agenda. So, today we are happy to bring back two great speakers. First, Dr. Del Lupu is Associate Research Professor at George Washington University, where her current research is in integrating palliative care into nephrology care. She has 40 years experience in hospice and palliative care. Her conviction is that the end of the story matters. Also joining us is Dr. Elizabeth Anderson, who is an assistant professor of social work at Western Carolina University. She practiced as a hospice and palliative care social worker, bereavement coordinator, and social services director for Mid-Atlantic Renal Coalition. One of her research projects is exploring best practices to engage family members of patients with kidney disease in rural communities. They will be discussing our topic of COVID-19 information overload, tips for keeping your head above water. As our panelists go through their presentation, and you have questions, please submit them using the chat feature through WebEx or the Q&A on the lower right of your screen. When we get to the question and answer section of this presentation, we will share the questions we have received with our speakers. Our goal is to answer as many questions as time allows. So what's this call about? You will hear tips to empower yourself to cope with COVID-19. We will share some real-world experiences that you can put to use. We have some resources for you to use and share with others. And a reminder, this series of calls is available to you weekly, offering a variety of topics. I will now turn the call over to Drs. Del Lupu and Elizabeth Anderson. Welcome.
Thank you so much. This is Liz, and I just want to start off by saying what an honor it is to be invited here today. Thank you so much to the NCC, and thank you all for having us. So if we could go to the next slide. So one of the things that we've been talking a lot about is this idea of information overload. I think probably like the rest of the world, you all are really concerned about what's going on in our world right now with all of the information about COVID and the pandemic, et cetera. And one of the things that I reflect on sometimes is how grateful I am that we aren't living in 1918 and that I have access to information at my fingertips. I can look at the internet, I can get a newspaper delivered to my front door, I have social media, all of my friends and neighbors are also reading all of these things and talking to other people. So we have this opportunity to be a lot more informed. But on the flip side, it really gets to be too much. I don't know about you all, but sometimes I think I'm going into the internet to look for one thing, and next thing you know, 2 hours have passed and I've read 16 zillion articles and gotten myself into a panic. So we know that the human brain can just only process but so much information, and yet we have all of this information in front of us, which can make us feel overwhelmed. So today, Dale and I really wanted to share with you all what we've learned from talking to people like you, talking to providers, and what we've also learned from our own training and expertise, and mine in social work and hers in public health. So if we could go to the next slide. So we're going to really break this talk up in two different ways. We're going to talk about The emotional response to information overload, so the overload part, the feelings that come up as a result of that and the anxiety that we get sometimes from that. And then we're also going to talk about the thinking part of that and how do we sort of adjust their thinking and make sure that we're learning information that is accurate as well. So we've got some strategies for you to stay afloat when all of this flooding of information happens. And these are the three things that we're going to go over today. Acknowledging emotions, recognizing when our own stories spin out of control, and then how do we really manage that flow of information because there is so much out there. Next slide. So the first thing we want to talk about is this idea of emotion. And I think that it's an important place to start, and this is the social worker in me saying it's an important place for us to start by acknowledging that we are emotional creatures. We are hardwired to have emotions, and that really is related to our survival. It is emotions that let us know that when we're in danger. It's emotions that let us know that we're safe. But too much, when we're going through something like this, we can have an overload of emotion, which can have this impact on, of course, how we feel, but also our physical health too. But the most important part of this is to recognize that it's normal and to pay attention to your body and try to identify what those feelings are. So for me, that might mean my heart rate's going up. I realize I'm breathing kind of fast. That's a good sign that I might be feeling a little bit anxious right now. So working on identifying what that emotion is. You can't fix a problem if you don't know what it is. The second thing is recognizing who are your emotional supports. We're certainly in a time right now where we're more isolated because of this pandemic, and yet I'm actually reading that some people are saying, I actually feel more connected to other people and feel closer to friends and family right now. So making sure that we keep up with our connections in a safe way, whether it be online, I kind of holler across the yard to my neighbors, but making sure that you have some supports because they can help ground us. Our support systems can help us realize our thinking is erroneous or, that we're being too negative, and they can also distract us and also give us something to look forward to. And then the third thing is cope. It says cope, and I'm not here to just tell you to cope because you'd probably all be like, oh my gosh, I'm trying, right? One of the questions that I've often asked people that I work with is to really reflect on a time in their life in which they had overcome something that was really, really difficult. And to really try to remember what it is that helped get you through that really difficult time. I hear people say things like, I was journaling during that time, or I took up painting. I found myself needing to get outside more. But really trying to search for what it is that has historically helped you through these times and bringing that back into your life in a really intentional way. Next slide. So I'm going to talk to you a little bit about what we as social workers, some of the tricks of the trade that we have. So one of the things that we acknowledge is that when we feel overwhelmed, a symptom of being overwhelmed or a real symptom of anxiety is actually having negative thoughts. So if I'm having a lot of negative thoughts, it's oftentimes because I'm feeling anxious or overwhelmed. And those negative thoughts, I'm sure you've heard the saying, my mind's playing tricks on me. That's kind of what it's doing. So our mind, our brains are hardwired actually to remember negative information. So some of the experts say that it takes 3 times as long to train your brain to have an automatic positive thought than it is to have a negative thought. So we're just hardwired for that. And in a pandemic, I think that's even more so. So some examples of how our thoughts spin out of control would be like, I have a case of all or nothing thinking. So that's like, I go to WLOS, my local TV station, and they said, We had a surge in cases yesterday, a record high. And my thought process is, oh my gosh, we're not safe anymore. The end of the world is coming. You know, I need to do all of these things. I need to run to the grocery store, get everything that we can to be safe. That I really miss the whole picture, that I just go from everything's okay to, oh my gosh, it's really terrible. Similarly, catastrophizing. That's like when I hear negative information that I go to worst case scenario. So for example, when they shut down schools in March, I immediately went to, oh my gosh, how am I ever going to work? Am I going to have a job? Do I need to plant a vegetable garden so we don't go hungry? I went to the worst place possible when really all that was not necessary at the time. Another example of spinning out of control is when we discount positive messages. So I was interviewing some people related to telehealth recently, and I had my colleague Caroline on the phone with me. And we got off of the phone and we were debriefing, and I said, oh, this telehealth is just awful. It's terrible. I don't know how we're ever going to do it. There are all these problems. And Caroline said, Liz, did you not hear that our person say that there were all these benefits they had not seen in a face-to-face visit in telehealth? And I was like, gosh, I just skipped that over, right? So my brain just held on to that negative piece and ignored some of those positive pieces. And so recognizing what that thought process for you is important. Next slide. So I'm going to tell you 2 tricks to deal with that kind of negative thinking. And the first trick is to pay attention to what you're doing when you find yourself having these really negative thoughts. So I suggest keeping a little notebook. And when you're feeling anxious or overwhelmed, write down what you were doing. And don't go back and look at it in 3 days. Go back and look at it in 2 weeks and see if you see some patterns there. Because for me personally, I find that I'm feeling anxious and overwhelmed after I have been on the internet for way too long. I also figured out that I'm feeling anxious and overwhelmed when I haven't gone outside in a long time. So recognizing what those triggers are and disrupting those, if you will. Next slide. And then the last thing is really paying attention to, if you're having a lot of negative thoughts about the news that you're taking in, are there ways to reframe that? So I've given 3 examples here. The first one is, I'll never see my grandkids again. Reframing that to, I'm so grateful that we have that FaceTime now so that I can actually see my family during this time. There are lots of different things that we can do. When I go to that place of like, oh my gosh, I feel really unsafe and scared, I go back to, okay, I am taking all of the steps and being really cautious so that my family can be safe. So I'm not necessarily reframing it into all puppy dogs and rainbows, but I'm reframing it into something that's reasonable and acceptable and helps me de-escalate from that place. So I'm going to turn this over now to Dale, who is going to walk through an exercise with us in helping connect that emotional piece to the thinking piece.
First, though, I'd like to just take a minute and help us all relax. So thank you, Liz. You made the connection that our thoughts can influence our bodies and our physical health. But if we work with our bodies, that can also calm our emotion, calm our sympathetic and parasympathetic nervous system. So you may remember the kind of old cliche that when someone's worried, they're wringing their hands. So we're going to take that and give ourselves a positive form of that, not a wringing of the hands, but a nice, gentle hand massage. So I invite you, if you just for 2 minutes with me, this is going to feel nice. You'll feel a little more relaxed. So just take your left hand and put it somewhere, either in your lap or if you can, on the arm of a chair, somewhere where it's resting comfortably. And then take your right hand and put your thumb in your elbow and your fingers on top of your arm, and just sweep 3 times from your elbow all the way down your hand and off the hand. You're just sweeping. You're just sweeping away anything you don't need. And just feel that sensation. It's kind of waking up the muscles there. Then turn the hand over as your palm is facing up and sweep on the inside of the arm, past the wrist, and down the hand, down the palm. Do that 3 times. And now you're going to take your thumb, put it in your elbow and your hand kind of wrapped around your arm, and just gently squeeze, moving like your thumb is going in a circle, you're squeezing your arm, and you're moving from your elbow all the way down, squeezing to your wrist, and then squeezing in the fleshy part at the base of the thumb, and moving around in the palm, and just feeling around in the palm of the hand, on top of the hand, circling with your fingers, and just kind of squeezing out anything you don't want. And then do that for each finger. Start at the base of the thumb and squeeze at the base, and just kind of twisting and turning and pulling. Pull all the way to the base of the thumb, or the tip of the thumb, not the base. Start at the base of the pointer finger and squeeze and pull all the way. Just pull right off to the tip of the finger. Do that for each finger. Each finger. I'm doing it as I'm talking to you. And then you'll put your thumb into the palm of your hand again and rub around, and then one more time just sweep from the elbow all the way down to the edge of the hand. And I'm going to invite you to do that while I talk, to keep going and do that same thing on your other arm. So you're going to just sweep on the outside, on the inside, and then work your way down just with nice circular motion on each finger. And that's that good wringing of the hands. Should feel good. You should feel like your hands have woken up a little bit now. So now let's turn to the cognitive strategies here. And that's that controlling the flow of information. So here are 3 strategies we're going to discuss. 1 is to define the question. 2 is to use trustworthy, reputable sources. And 3 is simply limit the amount, limit the flow. Let's go to the next slide. So the first thing is to define your question. So there's so much out there to know about. But what's important is for you to go find the information that's useful to you. So decide ahead of time what it is you really want to know. For instance, do you want to know whether it's safe for you to go shopping or you should pick up groceries? Do you want to know what you should be expecting in your dialysis center? What is it you would like to know? So even write that down ahead of time. And this is a strategy that we, health professionals use. We define what is the disease, what's the population, what's the treatment question we have. So decide ahead of time, write it down. Let's go to the next slide. Then you want to decide again ahead of time where to go to get information for that. So we're all hearing things from our neighbors, our families, our friends, and it's good to hear that information, but it's good to check it against more, I would call them scientific sources, sources that are in a careful and strategic way, looking at information and evaluating that information critically. So 2 sources I would suggest. The National Kidney Foundation has a number of resources specifically for people with kidney disease around COVID-19. So that's a good and reputable source. And for more general information about COVID is the Centers for Disease Control, CDC. And that's where the guidelines are emanating from for how we should open or close, or how your healthcare provider should respond. So that's a good source of information. And they have patient-friendly information. Next slide, please. And third, I would say go to ESRD National Coordinating Center. You're here, you're at this Quick&R, and in fact, for instance, NCC has a page that says where to find credible information, and it has some strategies it has more examples of places to go. So now you've done two things. You've decided your question, you've decided where you're going to go for information. Let's go to the next slide. So the third thing to do is just limit the flow of information. And I know you've heard this over and over again, but just decide ahead of time, do I really need to check 3 times a day, or is it okay for me to check twice a week? You know, it is changing. The information is changing. So I would say you probably want to check more than once a month. But is once a week, twice a week, and are you going to spend a half an hour? Are you going to spend 2 hours? You decide, different for everybody, but you decide what is the amount of information that is useful, will help you answer the question, and won't push you into that overwhelmed state. And then the nice thing is, suppose you had a question about, let's say, spread in my community, you know, what's the spread? And you went to, let's say you decide you're going to go to your county's website, and you went to it and you saw what, you know, that things were staying steady, and you did that in 15 minutes. You answered your question, and you had set aside an hour to do it. You now have 45 minutes to do something fun. Let's go to the next question. Next slide. So you should also have decided what are those things that uplift you. And Liz was talking about what are strategies that you used before to cope. Some of those strategies aren't available or are very difficult. You know, it might be sitting around with friends, and that's hard to do. I have a new thing of looking at puppy videos with my husband. But just, you know, what is something you can control? It may be on the internet, or it might be a favorite song that you're going to put on and listen to. So you decide a couple of things that really are reliable to give you a little lift, that little bounce. And if you answer your questions from those reputable information sources, then turn and use any extra time to do these uplifting things. Let's go to the last slide. So we're hoping that using these strategies will help you feel not so much that you're being flooded, but that you are able to control the information, you're able to float on it, you're able to surf it. Think of these nice metaphors of, instead of being flooded, you are floating, tubing down the river, or you are surfing. So it's a lot of information, but you've got the capacity to surf it, to use it well, and to use it to help you be in control of your situation. Liz, anything you want to add? I think we're ready to open for questions.
I think I am ready for questions too.
And I hope
all right, thank you. Go ahead.
A couple people did finish their other arm. I hope glad you through one. I hope you're not feeling lopsided.
Yeah.
I feel relaxed. Thank
Liz
you.
and Dale, thank you very much. We are now open for questions. If you haven't already done so, submit any questions you may have using the chat feature through WebEx. And as you were going through your presentation, we did get a couple of questions. I'll start with this first one. My question is for Dr. Lupu. I live in Houston. I live in the Houston area, and we get a daily update from the city leaders and the medical community. Then we get the nightly news, and they have doctors from the federal government saying something different. Who do we listen to and believe? This causes me the most stress.
Oh my, yes, this is hard. This is really hard. I would say you probably need to be listening to your local folks, because they know the local situation. The national, it's very different in one state from another. So I'm thinking that your local people are what's most impacting you right now. It is, the science is changing, and so things do change. But I think one thing that's a reality is people are viewing this in very, very different ways, and taking kind of the same set of information and presenting it in very different ways. And it's stressful to try to reconcile that. It really is. I would say what I find a strategy that I find it much easier, and this is not true for everyone, but for me, I find it easier to read the information, like to go to a website and read it, because I can then take that in at my own pace. When I'm listening, all the emotion, all the urgency of the daily briefing comes through, and I find that raises my stress. So I prefer to go to a website and read it than to listen to it on the news. That's just me. That's not, some people don't like to read. That's a style of how you like to bring your information in.
Okay. And someone else basically asked the same question: who do we believe, who to trust? We do have another question that came in. What about people that are not very mobile? I have a loved one that is used to watching a lot of TV, but I can tell the constant cycle of news about COVID-19 is upsetting her. She's not very mobile, so getting her out to go outside is tough.
Right. So one thing is to switch what, I think it was a she, is watching. So make sure that the diet of what she's watching is not only COVID news. So there might be some old comedy movies that she loves, or romantic movies that she loves, or science fiction movies. So if she can't go outside physically, get her outside in her mind. Go to a different time and place. And also, there are lots and lots of videos that are nice, small exercise movements for someone, even someone who's quite chair-bound. So I would find some Tai Chi or Qigong or physical therapy tapes, something that's for someone who's in a chair yoga. But I think suggesting, and you don't say stop doing this, but it's harder for someone to stop what they're doing than to ask someone to add something in. So if you can get her to add one movie, like Wednesday night for romance movies and Thursday night for adventure movie or something, that adds something, you're adding something pleasant in. I hope that's helpful.
Mm-hmm.
And I just want to say that these are real tough things we're facing. There aren't easy fixes to them. So I appreciate that people are bringing up the real problems that we're all facing.
I think to add to that too, also consider routine, helping people structure their day and have a routine often can, it does some of what Dale talked about earlier in helping people limit the information flow that they're getting. So they're still getting it, but there, are predictable parts of the day that they break up. And the other piece is that, I think a lot of times we tend to think that, oh, I know about, this person can't learn how to use the iPad for this sort of group. But I am finding and hearing from quite a few people that telehealth and support groups and those kind of things online are working. And so finding, are there groups of people that we can help this person connect with virtually? It might not be as good as face-to-face, there's no question about that, but it might be better than watching the news. So exploring some of those options too.
Yeah, and I believe we have time for one more question. Any advice for families with almost teenagers who are antsy and want to go play with their friends, but you also have a parent who is at high risk of COVID? It feels as though I can't catch a break.
I'm going to let Liz speak to this. She's living this.
Yes, I think it is. If you feel like you're at a risk, no matter what, you're at a risk if you don't let your kids go socialize, and you're also at a risk if you do, because then you're inviting in disease and that kind of thing. So I think, the piece is, again, expanding that. So focus on socialization, but what is safe. So virtual socialization. So for me personally, there's probably no research to ground this. I'm just telling you from my own perspective that I had to loosen up some of my criteria about, connecting with your friends virtually, because I recognized developmentally that they needed to do that, but we also needed to be safe because of some of our family members. The second piece of that is, letting we established some rules, like when we get to this certain phase or when this number of cases are down, then you can expect that this is going to happen. So we're giving them a glimmer of hope that this isn't forever, but they need, teenagers need very concrete rules. A lot of times they don't do very well with abstract rules. So I had to be very explicit. We're still in phase 1 right now. This is not acceptable, but when we get to phase 3, then we might be able to, meet some friends outside, socially distancing with a mask on, et cetera, et cetera. So I think, knowing on the back end what that is, giving them hope, offering accommodations wherever you can. And I've had to also be, just like I said about the other the other question that came up, be very intentional about, are there groups online? Like there are some youth groups that I heard about that, were getting together to do Minecraft gaming together. And so, in the old world, I might not have been super excited about that, but right now I'm like, that's great. So finding those connections and making them happen, I think, is an important part as well. And then forgiving yourself. I think that's the other piece, is like we really have to all be so kind to ourselves right now, because there isn't a book that tells us how to do this. And, we're all flying by the seat of our pants to a certain degree. And I think just, that honest approach with them is what I've done so far.
Yeah, I've been hearing a lot of people talk about being able to forgive themselves these days. So Liz, Dale, thank you very much for your insight. We always appreciate the information and the exercises that you provide during these calls. So thank you for being with us this afternoon.
Thank you for letting me. Yeah, thank you so much.
All right. We want to remind everyone about the kidneyhub.org. It's a mobile-friendly web app developed by the NCC with lots of input from our patient subject matter experts. If you haven't been on it yet, I highly recommend you try it. It has information on home dialysis, the kidney transplant process, infection prevention, mental health, and more. There's even a new video on high KDPI kidneys. Did you know that if you agree to accepting a KDPI kidney, you could get a transplant possibly sooner? Lots of great information on the kidneyhub.org. Check it out today. Our next patient Kokonari event is next Tuesday. We've teamed up with the American Association of Kidney Patients to separate the myths from facts surrounding COVID-19. And tomorrow on the professional COVID-19 call, Dr. Richard Perez, Chief of Transplant Surgery and Director of Kidney and Pancreas Transplant at the University of California, UC Davis Health, will share how UC Davis has continued to successfully transplant patients despite the COVID-19 pandemic. That's tomorrow at 5 p.m. And we have a program note. After reviewing the feedback we've received from you, starting April 5th, the COVID-19 Kokonari events will move to every other week and a new 1-hour time. So the first professional Kokonari event will take place on Wednesday, August 5th from 1 to 2 p.m. Eastern Time, and the patient Kokonari event will take place August 11th from 1 to 2. We thank you for all the feedback that you provide us about the COVID Kokonari events and the COVID-19 resources, and we will continue to make adjustments where we can. Thank you again for being with us this afternoon. For additional COVID-19 resources, visit the CASER website at casercoalition.com. You can also review additional COVID-19 tools at kidneycovidinfocenter.com. Thank you, everyone. Have a good evening.